In today's video, I'll be covering Medicare Part C, also called Medicare Advantage. Hi, I'm Duncan, owner and founder here at Trusted Benefits Direct, and I specialize in helping seniors find the exact right Medicare Supplements, Medicare Advantage, Part D plans, and a lot more for their exact needs. I hope you will consider using me as your agent. This is how I make my living, and by the way, all of my services are free. Now, before I start, there is something I want to say. You will see a lot of videos on the internet talking bad about Medicare Advantage. While Medicare Advantage has many disadvantages, it also has many positives. I have clients on Medicare Advantage plans that are perfectly happy. I also have clients that are on Medicare Supplements and they are happy as well. My goal with these videos is not to steer you to one product or another. My goal is to present the facts of everything to allow you to make the best decision for what your needs are. Many times we have husbands and wives on different programs with different companies. And the reason being, Medicare, it's not one size fits all. That's why there's many options. It is because of these options, Medicare can become very confusing, but it's my job to answer all of your questions and help you pick the exact right plan for your needs. I'm asked by almost everyone, Chris, what is better, Medicare Advantage or original Medicare with a Medicare supplement? And my answer is, let me present you the facts. Then you will ask me questions and I'll answer those questions and it will become very clear which is going to be best for you. What is exactly right for you is probably not exactly right for your neighbor or maybe a family member. We want to get you what is exactly right for you. Okay, let's get to why you're here. First question to answer is, what is a Medicare Advantage plan? I take this right from Medicare's website because I think it answers the question best. It states Medicare Advantage plans, sometimes called Part C or MA plans, are an all-in-one alternative to original Medicare. They are offered by private companies approved by Medicare. If you join a Medicare Advantage plan, you still have Medicare. We're going to talk a little bit about that here in a second where it says you still have Medicare. But these bundled plans include Medicare Part A hospital insurance and Medicare Part B medical insurance, and usually Medicare drug coverage Part B. Like I said, I want you to pay particular attention to the sentence, if you join a Medicare Advantage plan, you still have Medicare. Now you might be asking, why are they telling me if I get a Medicare Advantage plan, I still have Medicare? Why wouldn't I have Medicare if I get a Medicare Advantage plan? The reason they say you still have Medicare is if you elect to get a Medicare Advantage plan, it is literally a replacement for original Medicare. Medicare Part A hospital insurance and Medicare Part B medical insurance is also called original Medicare. Original Medicare is a very important term to know. When you have original Medicare, the federal government is your primary insurance. Medicare is your primary insurance. They make the decisions on what is covered and not covered. Getting back to Medicare's definition of Medicare Advantage, they state that Medicare Advantage plans are offered by private companies approved by Medicare. This means that if you elect to get a Medicare Advantage plan, your primary Medicare coverage will be coming from the private insurance company and not the government or not directly from Medicare. So you still have Medicare, but your coverage will be coming from the private Medicare Advantage company and not original Medicare. These are the basics about Medicare Advantage, and when you start to understand the basics, you get to make good, informed decisions on what is best for you. Next, let's get into the positives and disadvantages of Medicare Advantage. And there are a lot of positives and disadvantages. This is where some of you will really make your decision if Medicare Advantage is right for you. I like to start with the positives, so here are the positives in my opinion. First positive is many of the Medicare Advantage plans have low to $0 monthly premiums. There are some that will actually rebate you back money to help you pay for your Part B premium. One thing I need to cover is you always must pay your Part B premium to Medicare. I get asked many times by new Medicare beneficiaries, if I get a Medicare Advantage plan or a Medicare Supplement plan, do I still have to pay for Part B of Medicare? The answer is absolutely yes. We know Uncle Sam isn't going to miss out on getting any of our money. Many Medicare Advantage plans, like I said, have a $0 to low monthly premium, and many also cover Part D prescription coverage as well. It is these low costs that make Medicare Advantage a very desirable option for many. It is these low costs that lead the way why some of my clients decide to have Medicare Advantage. In addition, Medicare's website states most Medicare Advantage plans offer coverage for things original Medicare doesn't cover, like some vision, hearing, dental, and fitness programs like gym memberships or discounts. Plans can also choose to cover even more benefits. For example, some plans may offer coverage for services like transportation to doctor visits, over-the-counter drugs, and services that promote your health and wellness. Plans can also tailor their benefit packages to offer these benefits to certain chronically ill enrollees. These packages will provide benefits customized to treat specific conditions. Another question I get asked about Medicare Advantage is, how can these plans be free, or how can they pay me for being on their plan? And remember when I outlined that Medicare stated that if you have a Medicare Advantage plan, you still have Medicare, but you get it from the private insurance company. What this means, and I'm going to take this right from Medicare's website, and it states on Medicare's website, Medicare pays a fixed amount for your care each month to the companies offering Medicare Advantage plans. So what ends up happening is, instead of Medicare paying your bills directly, what happens is Medicare pays a monthly premium to your Medicare Advantage company that you end up picking instead of paying your medical bills directly. Another positive is Medicare Advantage plans have a maximum out-of-pocket. Having original Medicare only doesn't have a maximum out-of-pocket. Medicare Advantage plans are basically pay-as-you-go plans. You make a co-payment for each service you get. You may have a co-payment to see a primary care physician or a specialist, a co-pay for being an inpatient in the hospital, a co-pay for an MRI or an X-ray. There are many of these co-pays. But these Medicare Advantage plans have a maximum out-of-pocket that you're responsible for. This max out-of-pocket is for services that would fall under Part A and B claims. The highest out-of-pocket max in 2021 a Medicare Advantage plan can have is $7,550 for in-network services and $10,000 for out-of-network services. More on these in and out-of-network services in a minute. The numbers I just mentioned are the maximum set by Medicare. Each plan may have different max out-of-pockets, but the highest they can have are these set numbers. Now, I have some clients that are on Medicare Advantage plans with max out-of-pockets as low as $999 for in-network services. Each plan can be different, and that is one of the things I believe someone considering a Medicare Advantage plan should look at closely. And using an independent agent like myself, in my opinion, is a great way to shop for these plans. Being independent allows me to present each plan's coverage and options objectively. When calling a Medicare Advantage company directly, they will only be able to tell you about their plan and cannot compare all of the companies. And you can decide what type of objectivity you would get when calling a company directly. But with me, I'm here to listen to what your needs are. Look at everything available and get what is in your best interest. Call or email me for help. Now that takes us to the disadvantages. The main disadvantage I see and what my clients tell me is the number one reason they don't want to have a Medicare Advantage plan is the potential of a very restrictive doctor network. Most Medicare Advantage plans operate within an HMO system. You don't know, that stands for Health Maintenance Organization. This means there is a network of primary care physicians, specialist physicians, hospitals, durable medical equipment providers, and more. This means that if you see a provider of some sort outside of this network, unless you are having an emergency, and emergencies are always covered anywhere in the United States, and some Medicare Advantage plans actually have worldwide emergency coverage. But if you see a provider outside of the network, in almost every instance, you will be responsible to pay 100% of the bill. If you need to see a specialist, in most HMO plans, you need a referral from your primary care physician first. In fairness to Medicare Advantage HMO plans, some have added a benefit in them that allow you to self-refer to in-network specialists. Although there are not very many of these plans, but they are available in some areas. Many times when I explain how an HMO network can be restrictive on the doctors with my clients is when our conversation shifts to keeping original Medicare and purchasing a Medicare supplement to cover the gaps of Medicare. Another disadvantage of the Medicare Advantage plans is the network of doctors can change at any time. When you enroll, your doctor may be in the network, but later in the year, that doctor or plan may decide to not contract together any longer. This wouldn't be a big deal if you could simply change to a different Medicare Advantage plan anytime during the year, or simply return to original Medicare, but you can't. The time frames to make elections in and out of a Medicare Advantage plan are very restrictive. I said I would touch on HMO and PPO Medicare Advantage plans. I described the HMO, so let me briefly describe the PPO plan. PPO stands for Preferred Provider Organization. When you have a Medicare Advantage PPO plan, this means there are in-network providers, and they are the ones that have already agreed to take the plan. And then there are out-of-network providers. Basically, the in-network providers have agreed to the terms and payments from the plan. Any provider that isn't in the network hasn't agreed to the terms and payments. If you have a Medicare Advantage PPO plan, you know you will have coverage for any in-network providers. In general, the list of PPO in-network providers is much larger than an HMO network. But with a PPO Medicare Advantage plan, you can also have coverage potentially to any provider that is not inside of the PPO network. It's really like a hybrid plan. However, you need to be careful when you are being educated about these programs from unskilled agents. They will often tell you, you don't have to worry about networks with a PPO plan because this plan has in-network and out-of-network coverage. Now you may have coverage, but the provider you see may not accept the plan for payment, leaving you to file claims with your Medicare Advantage plan and potentially have additional out-of-pocket costs. Last disadvantage I will talk about is each Medicare Advantage plan can charge different out-of-pocket costs. Each plan can and does have different copays for services. For example, some may have a $0 primary care physician office visit copay, and some may charge $20 or more. Some may not have a copay to be an inpatient in the hospital, and some may charge $500 a day or more for a certain amount of days in the hospital. The copays can vary greatly from plan to plan, and the copays can change every year. Now I'm going to get on my soapbox here for a moment, and I'll try to keep it brief. In my opinion, it is important to talk with an independent agent that believes in both Medicare Advantage and original Medicare with a Medicare Supplement. I have many people across the country that find my videos and they have signed up for a Medicare Advantage or Medicare Supplement through an agent without knowing that both exist. The television commercials with celebrities like football Hall of Famers and actors are trying to get you to call in, and the people on the other side of the phone, they want you to get a Medicare Advantage plan. They will likely only tell you the positives without outlining the negatives. Many times, agents that you contact are employed by a company that only represents one type of plan or company and simply won't tell you about the other options. Many times there are agents that simply don't believe in Medicare Advantage or they don't believe in Medicare Supplement and won't offer both options. They won't even talk about it. They won't tell you about them. In my opinion, agents that just offer one or the other just don't want to do the work to become experts in both. And usually the agents that don't believe in a particular program, they don't believe in Medicare Advantage. Again, in my opinion, it is easiest not to believe in Medicare Advantage because it is a lot more complicated than original Medicare with everything that Medicare Advantage can offer. In addition, because Medicare Advantage has all of these options, the amount of training agents must do every year to stay certified to provide Medicare Advantage can be very difficult, extremely time-consuming, and expensive. So instead of doing the necessary certification every year, those other agents, they may say something like, oh, Medicare Advantage it's just very restrictive and you don't want it. And they won't even explain why. Now I choose to learn and spend the extra time and money to certify to provide Medicare Advantage so you get the full story. And if you have seen my other videos, I always say I'm here to present all of your options to help you make the exact right decision for your exact needs. I don't advocate for one or the other. I just want you to get what is best for you. And I hope you use me to get it. Okay, thanks for sticking with me through that. These are the main positives and disadvantages of Medicare Advantage plans. There is a lot more to these plans. If you want to learn more, I suggest a couple of Medicare publications. First is the Medicare and You Handbook that Medicare puts out every year, and also Medicare's official guide called Understanding Medicare Advantage Plans. Depending on where you are watching this, there will be a link somewhere to download your own copy if you don't already have them. This went a little longer than I wanted, so thank you for watching all the way through, but I feel what I covered is very important to help you decide if Medicare Advantage is right for you. Now it's time for the quick recap. Medicare Advantage Positive, $0 to low monthly premiums. Usually have Part D prescription coverage. Can cover extras original Medicare doesn't cover, like dental, vision, hearing, fitness coverage, and transportation to the doctor, over-the-counter drugs, and other things as well. The Medicare Advantage plans, they also have a maximum out-of-pocket. The disadvantages: they can have very restrictive doctor networks, unpredictable copays. The doctor network can change at any time, and each plan can have different copays, and they can change every year. Again, I'm Chris Duncan. If you have a question about this or anything else Medicare related, I'm here to help. I help with Medicare Supplements, Medicare Advantage, Part D prescription plans, dental, vision, hearing plans, final expense life insurance, also called burial insurance, and protecting retirement savings and more. If you'd like my help, it's easy to contact me, 800-910-3382. I look forward to seeing you in our next video.